Hey everybody, it's John Bill. This is the follow-up video to the ketamine and etomidate update presentation we did. We're going to talk about the method of diluting the 500 milligram ketamine. So first of all, if you have your 200 milligram vials of ketamine still on your trucks, use those. It's a normal day. You don't have to bypass this and use the dilution method. This is for when we run out of these, and we're pretty close to running out of them. So we're going to start stocking two 50cc bags of normal saline in the NARC box, in the NARC bag with the ketamine. So it should be right there. The reason why we're using 50cc bags of saline is because it reduces your math, so you don't have to figure out how much saline to pull up in a syringe versus how much ketamine to add to that. It's less load on you at the bedside. So it doesn't matter what your dose of ketamine is, doesn't matter how much they're going to get. You take your dose of ketamine, you put it in that bag, you hang it, and you let it go. That's it. So this is just being treated essentially as a hanging pre-filled syringe. We chose a 50cc bag because once you put your ketamine in here, depending on the size of your IV catheter and all the other variables that affect flow rate, this is going to give you about a 1 to 2 minute infusion. So, which is perfectly appropriate, right in line with how slow we should be infusing is the word I'm looking for, infusing ketamine anyway. So how are we going to mix this up? You get your 500 vial of ketamine. Concentration is 100 milligrams per cc. So let's say my patient weighs 100 kilograms, so I'm going to give them 200 milligrams. So I'm going to draw up my 2 cc's of ketamine, take that, put it in the bag, get it all mixed up. I'm going to hang it and then just let it go, wide open. There's no drip rate, no infusion. We're not doing any math with this. You take your ketamine, you put it in the bag, you hang it, and you let it go. And once it's empty, your ketamine's given. After that, everything else is the same. As far as resuscitation, pre-oxygenation, hyperoxygenation, all that kind of stuff. Your sucks, same, everything's the same after that. We are going to have 2 bags of normal saline in the NARC bag. So if you want to redose, you take your same vial of ketamine, you pull your second dose out, put it in that second bag of saline, hang it, and let it go. That's it. Now this is another few reasons why we're doing it this way. It prevents prevents overconcentration of your ketamine. So if somebody makes a mistake and they end up putting this entire vial of ketamine in that bag, don't do that. But if you make a mistake and that's what happens, you end up with a concentration of 10 milligrams per cc, which is the same concentration as our 200 milligram vials, which is a safe concentration to give your patient. So you don't need to pull any fluid out of that bag. You don't need to do anything with the bag other than put the ketamine in it, hang it, and let it go. This is not a permanent change we're making. It's a temporary change. We're not trying to add to the stuff you have to do. We're just trying to work with the ketamine that we have and give that in a safe manner. So once our supply of 200 milligram vial ketamine returns, everything will go back to normal. But in the meantime, there's not a whole lot of thinking involved in this. Easy for you, safe for the patient. We feel like this is probably the best way to do it for now. If you have any questions, you can call me, email me, text me, get with your FTOs, your lieutenants, your captains, and we'll do whatever we can to help you out. But the bags of saline are on the way right now. As soon as they're here, they're going to be put on the trucks, and this change is going to go live. So to reiterate, if you have 200 milligram vials of ketamine still on your trucks, use those. If you don't, we're going to use this method as soon as we get those bags of saline in. When we start doing this, when you need to restock your bags of saline, they're in the Omnicell at the hospital. You just type in normal saline, it'll pop up 50 milliliters, get that one. And I think that's about all I have to say about that. So questions, comments, concerns, get with me or your shift leadership and we'll do what we can to help you.